Okay, here we are. Last podcast of the year. As promised, it's, as the kids say, an AMA, which for anyone over 45, actually anyone over 40, no, I'd say most of my peers know what an AMA is. It's an Ask Me Anything. Did I have to Google that because I kept seeing it on people's Instagram stories? Yes, I did. But now look at me, an armchair expert on social media. Here we go. We're delving into your questions, what you want to know from little old me, which after a year of listening to me, I am shocked that you have anything to ask because I am constantly giving my opinion on things that people don't even want it. So here we go. We've got Ryan, because he's my number one, and he's going to be asking me your questions. Maybe he'll pop in one of his own. Who knows? Let's get wild.
Okay, question number one. I'm going with the broad questions first.
Okay, I like that.
Biggest thing we should be doing for our fertility health?
Let's start with an easy one. I think the number one thing to do for your fertility health is to take care of your overall health. One of the issues that I run into most is that we have completely segmented ourselves into health and fertility, but they are very closely related. So I know that seems very broad to another broad question, but it's important to understand that especially things like unexplained infertility are often an issue with something that you would think had nothing to do with your fertility, like circulation or a clotting disorder, a hyperactive immune system, or insufficient iron. All of those things wouldn't have been necessarily classified as a fertility issue, but they are an issue for your fertility. So if we're going to make this easy, number one, if you're going to start trying, I would start off with going to your doctor and getting a basic day 3 blood work if you are a female. What that entails on day 3 of your period, which means day 1 is the first day that you see blood. On day 3 to day 4, day 5, that's the window, basically from day 3 to day 5. You go to your doctor and you ask for day 3 blood work, which would be FSH, follicle stimulating hormone, AMH, anti-Mullerian hormone, LH, luteinizing hormone, and you can also get estrogen done. See where that's at. I don't find progesterone at that point in your cycle particularly useful. You can also, if you're concerned about PCOS, get your total testosterone tested, your DHEAS, and insulin along with cortisol. That should give you a pretty good picture of what's going on and whether or not you need to then do imaging. That would be my very basic start. After that, if you're concerned about irregularity with your menstrual cycles, you can get a basic pelvic ultrasound. But in a lot of the cases that I've run into, patients will have that done and then think to themselves, I don't have, any outstanding markers. Like I don't have any large masses, or they can't see endometriosis, which makes me nuts because endometriosis needs to be diagnosed by an endometriosis specialist, one of whom we had on this podcast, Dr. Matthew Leonardi. You can't just get a basic ultrasound to identify that. So those would be our basic markers for men, because you should both get tested. You can get a blood test to determine what's happening with your FSH and your testosterone, as well as a CBC for both of you, a complete blood count. And for men, it's absolutely crucial. If the two of you are going to start trying to have a baby, you must get a semen analysis. I don't understand how women will go to the fertility center. They will get all of their tests done, all of the blood work. They will get a sono, which involves putting fluid through the fallopian tubes And that seems reasonable to do as a start. But men won't jerk off into a cup, something that I'm certain they have done many times before. Have I just gone off on a rant? Yeah, but it's my podcast. I can do whatever I want. But seriously, get a semen analysis. It's insane that you won't, because the number of you, I mean, so many of you are lovely, wonderful, conscientious, caring human beings, and you'll make wonderful fathers, and I'm very excited for your children. But some of you think that you are above the semen analysis. You will have your partner go through a rigor of insane testing before you are willing to go and have this very basic test done. If you are able to afford it, please also get a DNA frag. Your doctor will say, we don't know if it's important, but guess what? 50% of all miscarriages linked to DNA frag. So wouldn't it be nice to know from the start? And if the pushback is, well, the only thing you can do is lifestyle, wouldn't it be nice to have the motivation to get started on that lifestyle? I say yes. I'll get like messages. Why should I take this antioxidant? Why should I avoid the shower? And then we're talking like really hot showers. And then I send them back research. I don't hear anything back. 3 or 4 days goes by, and I do DM back. I say, did you read the article? Do you think they read the article? Of course they didn't. Anyway, this isn't, we won't get started on like I hate on, but I do feel like the expectations of men, and it starts here. You'll see parenting Instagram accounts where women specifically, predominantly, are complaining about being the parent who has more to do. What is it called? The default parent. That's like the psychological term, I think, that's being bounced around, where they are, responsible for the majority of the child rearing. You can start this process at a semen level. Get the expectations started that the two of you are on an equal playing field. And maybe parenting will be less challenging. If you expect less from your partner right from the conception, guess what? They're going to give you less. Maybe that's controversial of me to say, but again, it's the last podcast of the year.
Okay, moving on.
Okay.
Moving on. I mean, it kind of relates to the question we just answered, but I think doing this is a good chance for people to ask extremely general questions, because sometimes you take for granted that people don't know even the most like rudimentary things. So just a basic question.
Okay.
Why are so many people experiencing infertility now?
I think a lot of practitioners would point to things like people are having children later, or our environment is very toxic, both of which I don't necessarily agree with, because I believe that the human body is pretty resilient. And I see patients getting pregnant well into their early to mid 40s on a daily basis. So I just don't buy that. And most of those patients are people who initially went straight to IVF because they were stressed out about their capacity to conceive at their advanced age. It then didn't work, and then they end up coming to me expecting like a Hail Mary scenario, which isn't really a Hail Mary scenario. It's just a matter of like lining up the dominoes and encouraging them to be in their very best health, and then looking at the statistics each month of how likely it is for women of a certain age to become pregnant, and then just beating out those stats. So if your chances are 10%, well, then you're going to just have to try every single month of a year, and you're going to just have to remain hopeful and set yourself up every single month to win. Fertility is just like anything else. If you played a sport, because everything for me always comes back to sports. If you played a sport, you expect to win some of the games. You don't expect to win all of the games, but you go to practice and you practice as though you're going to win regardless. Nobody's going in at like a university level and just sort of like kicking a ball around or just giving, a couple good laps on the track team. That doesn't happen. You line yourself up and you optimize every aspect of your training in order for you to go to the competition and feel super strong. That's what you got to prepare yourself for every single time for ovulation. So I think it's less about we're generally experiencing more infertility. And I think a lot of it is that we've been convinced that we are infertile because it doesn't happen right away. So giving yourself realistic expectations, I think, is number one. Number two would be we're not expected to optimize our own health, relaying back to question number one. So if you are not in good health and then you expect your body to conceive, that's not going to happen. So you have to, get enough sleep. You have to eat well. You have to eat food that actually responds well in your body. The number of people that I say, how's your digestion? And they say, well, it's good when I eat what I'm supposed to. Well, then just eat what you're supposed to. 90% of the time, eat what you're supposed to. 10% of the time, YOLO, and yearn back to when you used to eat what you were supposed to. That's what I do. Every time I'm like, I'm going to eat this sourdough toast. And then an hour later, I'm like, why did I eat that sourdough toast? I yearn to be back to the days when I just had eggs. So overall, number one, expectations. Number two, general health. Number three, GPs no longer help patients. They send patients immediately to a fertility center. That is problematic because fertility centers, for the most part, are private. They are not going to do all of your testing and then tell you, leave, we don't want you here. A few doctors do. I love those doctors, and those are the people that I typically will be referring to. But there's also a number of fertility clinics, specifically in the GTA, where I know that if a patient has been sent there, regardless of the patient's age, regardless of how uncomplicated their case, they're getting IVF by the end of the year because they've been convinced that their 20 AMH is perilously low and they're on the verge of menopause. You're not. So, expectations, wellness, GPs helping people understand their fertility at a very fundamental stage before they are freaking out that they are infertile. And then, of course, obviously, there's like environmental toxins. But if a man is going to blame, for example, environmental toxins, radiation, having to sit all day for work, commuting, if we're going to blame all of that and we're not going to take any personal responsibility, like increasing weight training, having the antioxidant supplements that we know improve sperm, eating well, reducing drinking, cutting out smoking completely, reducing THC to a 0. If you're willing to do that, I guarantee you, your sperm quality is going to. But I think just like our expectations of men have gone down, our expectations of their sperm have also gone down. And as a result, since they are 50% of the equation, we are dealing with more and more infertility. So we've all just got to buck up, stand a little taller, have more expectation of ourself and our healthcare, and stop falling victim to this concept of well, we're doomed now. We're all going to be infertile now. Shake yourself off, guys. We're going to be fine. If a little loser like me with one sad little ovary and my husband who's he's got one ball, we really are two peas in a pod. The other one didn't descend when he was but a youth. And in Bulgaria, they opted not to operate on it. So if the two of us can have 4 children, I had 2 children prior to that with my ex-husband, who, to my knowledge, has both of his balls, but is otherwise pretty incompetent. If we can have 6 kids collectively as a tri-unit, you guys have got a chance. Let's go.
Okay, moving on.
Yes.
Okay, I got to give everyone a quick snapshot of our podcast metrics. As soon as the 3 letters IVF show up on any title or any description, it becomes an episode that does very well. So that leads me to question number 3, which is IVF related, obviously.
Obviously.
Someone writes in, what should I ask in an IVF consultation and things to look out for?
So I received a positive pregnancy test from a patient this morning who was very resistant to doing IVF and whom I ended up begging, please do IVF because it is extremely appropriate for you and we will have much better results. So the idea that I am anti-IVF is incorrect. I'm very pro-IVF for the right patient. So, number one, it's very important to determine whether or not you are, in fact, that right patient. We've had a number of guests on here, Rachel most recently, where you can just listen to her story and you can determine, okay, she's not a good candidate for IVF. So, things that you need to understand prior to advancing your meetings is when you initially go in, is your AMH perilously low? Is your FSH incredibly high? If both of those metrics are in those directions, IVF is not for you. Now, if you are unfortunate enough to not have fallopian tubes, then we have to just try our very best, regardless of the FSH being high and the AMH being low. So you can improve both of those metrics by taking care of, once again, your lifestyle. Acupuncture specifically has been proven to increase AMH and decrease FSH. My suspicion is that it's by reducing systemic inflammation. You can improve both of those metrics similarly with healthy diet and moderate exercise, along with supplementation that again promotes a decrease in systemic inflammation, reducing cortisol, very important, improving circulation, very important. When you go in, though, for that consultation, you need to identify why you are there. And you need to, the patients that I have who have success are patients who have a diagnosis. So if you're doing IVF because nothing else has worked, but you don't know why nothing else has worked, then you need to press on. You either get a consult with another physician, because guess what, guys? Even though when you go in for that consult, it's going to feel like, oh my God, it took me so long to get in here. I'm never going to be able to get in to any other clinic. Put your name on multiple lists. You can get as many opinions as you want. Because at the end of the day, myself included, your specialists are going home, they're eating dinner, they're watching TV, and they're not going to obsess over the fact that you don't have your family that you picture. Some of us will obsess over it. For the most part, though, you're taking it to a personal level. So many people don't want to offend their fertility specialists, and so they don't seek, alternative expertise. They don't seek, alternative opinions. They think that the person that they go to is the only person that can help them, and that's incorrect. So you need to find a team who is going to find the reason for why you are there. Then you need them to identify the solution to that problem. For example, I have one patient who recently came to see me after her first round of IVF didn't do very well. And we focused on looking at, okay, well, this is a very general protocol. You are older, you have low AMH. There's good studies that a duo-stim might be appropriate for you. Why not try these meds, which are much more tried and true, albeit more difficult to administer? That's something also. I'm not going to get into the specifics of medication because this is too broad of a topic and it's, again, needs to be tailored to the patient. But a lot of the new medications for stimulation, I've run into issues when it's like a combo pen. I don't see the same results. And dialing it back to old school, an example would be like Gonal-F and Menopur as two different medications working towards the same result. I see better quality. Now that's just like my, snapshot of my practice. That's not necessarily going to be the case for everybody, but asking about, can we do less medication and work on quality? Can we use medications that you've seen work really well for other patients who are in my shoes? What is your opinion of adjunct therapy, like acupuncture? And what kind of supplementation would you recommend that I start doing 3 months in advance? Because when people are like, oh, I'm going to start taking CoQ10 and I'm doing IVF next week, that's going to do absolutely nothing except maybe thin your blood and reduce your blood pressure. So why bother? Like anything in life, if you want it to be successful, you have to plan for it. Nothing should ever be rushed unless it's like an extreme circumstance, like you're having your ovaries removed. Dial it back. Don't let your emotions rush you through, because then 3 months later, you're going to be wishing that you had taken those 3 months to prepare yourself. Now, this is like 10 years of experience. People will come in, they won't listen, and then they'll be back 3 months later. Don't be one of those people. Plan yourself. You've got more control over this than you think.
Okay, I'm going off the board here with another question because as you keep talking, I'm thinking of, I feel like people want very basic questions answered. And sometimes
Right, I'm not a basic gal.
I know exactly, but I think you have to almost make it basic and then you give kind of your nuanced answer.
Right.
So in my head, I'm thinking about a couple that is struggling and they need to make a lifestyle change and they need to go to the grocery store and start purchasing things that can help them make that change.
Okay.
If you're walking into a grocery store, what are you grabbing off the shelves to boost your fertility?
Okay. I'm going to answer that after the same couple promises to get a journal so that they can write down how they feel after they consume certain food. Because if you, for example, are going to be following research like full fat dairy benefits egg quality in patients who are undergoing IVF, but you also have a lactose intolerance, that is not the food for you. And it will make you feel worse, which will then cause inflammation and not have the effect that you're hoping for. So I think it's really important to be self-reflective and understand what foods you should and shouldn't have as your own unit. Like, for instance, I shouldn't have corn. I shouldn't have chickpeas. I shouldn't have lentils. I'm okay, actually, to consume dairy in small amounts, and I'm totally fine if I eat wheat. I don't eat wheat because I know about the research around what it does to my body, but I know if I go and I have a piece of toast, the worst thing that's going to happen is I'm going to have like a blood sugar crash. So I'd say stick with the basics. Buy fresh food first. Don't buy packaged food. Stick with things that are simple. I avoid, and I'm going to actually, you're right, because I had a patient yesterday who's been seeing me for a year. And I was like, okay, in order to reduce your cytokines, your inflammatory markers, I need you to no longer have grains. And she said, absolutely. What's a grain? So avoiding wheat, rice, oats, corn. Goodbye. Google paleo meals. Super easy. All of these recipes, incredibly easy. Eggs. What a win. Complete protein, inexpensive. You can make it in a pinch. You can make it. Anyone can make eggs. My 12-year-old can make eggs. Fresh fruits, vegetables, eggs, good quality protein. I prefer animal protein. If you're a vegetarian, then this is going to be less of an easy throw for you. Nuts, seeds, good quality olive oil, vinegar if you don't have a yeast concern. I do think that full fat dairy, specifically like a good quality Greek yogurt, is a good source of protein. And if you don't have copious amounts of it every single day, I don't see a ton of dampness happening or bloating, et cetera, and so forth. but I would stick with your very basic whole foods, avoiding grains, avoiding legumes, which lentils, beans, chickpeas, peanuts, because they're hard to digest. And interestingly, a lot of the time, patients who have endometriosis, the thing that I notice is that their digestion will be skewed. Their periods will be fine. But I've sent them off to go and get a referral to see if they have endometriosis because their GI is always off. And lo and behold, they have endo. So look to optimize your digestion first because it helps with the quality of all of your energy, blood from like a TCM standpoint, Chinese medicine standpoint, but also brain health, mood, your inflammatory response, your immune system and how regulated it is. All of these things are tied predominantly to what you eat and what's going on with your digestion. So if you're eating crap and you expect to feel great, best of luck.
Okay, next question. We hear a lot about people in fertility clinics around this area, but also people who live in the States or people who don't live in the greater Toronto area. So I have a question. How to choose the best fertility clinic and what to look for?
This is somewhat controversial. Shocking! I am in Oakville currently, and I can say without hesitation, I just hesitated. There's only one clinic that I would send patients to, and there's only one doctor that I ultimately trust. I find a lot of the time if a clinic is not capable of treating any and every aspect of a fertility problem, they should not be the clinic that you're opting to go to because you don't know what you need. If you have something that you already understand, your tubes are blocked, for example, a basic fertility clinic is going to do the job. They'll be able to do a retrieval. They'll be able to fertilize the eggs. And given, you have decent sperm quality that you're working with, and they'll be able to do a transfer and biggity boo, you've got a baby. But if it's not that simple and you're going because you haven't been able to achieve pregnancy and it's been a year of trying, then you need to find a clinic that's going to be able to treat your immune system. They're going to be able to test for clotting disorders. They have competent and compassionate doctors, not just competent and compassionate on the internet. Like you see them on an Instagram live and think to yourself, oh my God, they're so compassionate. They're such angels. And then you go to the clinic and you're like, who the hell was that? You want to get opinions. Go onto the reviews of these clinics and look for the outliers of this person that I saw at this clinic was amazing. They listened to me. They were thoughtful. They gave me good care. Their team was on board. And if you see that as an ongoing trend, choose that clinic. Don't ever choose a clinic because your GP has sent patients there in the past and the patients have gotten in. This is your family. This is important. This isn't just like an aesthetic clinic where you're like, oh, who's going to give me the best facial? This is your family. So please take the time, research. The best reviews, the best advice are given by those who have already experienced those clinics. And if you're going to a new area, before you go to a fertility clinic, go to a really well-known and experienced acupuncturist or naturopath because they will know the clinic and they will know the doctor that is going to be best for you because it's part of what we do. I talk to, between 40 and 50 people a day about their fertility. I get the reviews from what's happening at the clinic, how people are spoken to, how they are treated, and I make notes, like a little creepy concierge of the fertility world. Trust those who are already in the field as opposed to one person who told you to go here, or worse, the clinic that's closest to you. I understand convenience is key, but oh my God, Don't go somewhere because it's close to you and has good parking. This is, again, your family. You wouldn't do that for anything else. So I don't know why you would opt for this for building your family. It's just insane.
I'm going to post that part as a separate YouTube video. And anyone who's watching this separate YouTube video, please go back and listen to the podcast about all the stories of people going to clinics because of convenience, because of parking, and how many times they've been like, I never should have done that. The amount of money that people have spent because of mistakes like that.
And like emotional fortitude.
I think one thing I've learned is in your fertility journey, like you must go to absolute depths to make sure you are getting the best care.
And
like,
the right person.
And it's you cannot have convenience be any sort of factor in your decision to do anything in fertility.
Yeah. 100%.
Okay, last question. Have you considered doing a practitioner training to help other ACUs with fertility patients?
This is something that I get asked almost every day over the Instagram about when I'm going to launch a practitioner training program. In 2025, I am going to launch Anne's Notes. What? So I think I'm going to take on a few itty bitty trainees, mentees in 2025 because I need more acupuncturists and naturopaths that I can send patients to with a great deal of confidence so that I'm not concerned when patients come back and say, oh, so-and-so is going to have me take Vitex. And I'm like, why? And they're like, well, they think I have a luteal phase defect. I'm like, why? They're like, well, I start to spot. And I'm like, that means so many other things, not just a luteal phase defect. And so it's not so much that I haven't wanted to. It's that I have had an imposter syndrome that I have been battling through where I've thought to myself, why would anyone want to learn from me? Most of the case that I treat do end up becoming pregnant. I'd say like 95% of all the patients who will walk through my door will walk out a graduate. And that should have been enough for me to feel confident. But I'm just like everybody else. And even though, I receive daily feedback and daily proof, I still haven't felt good enough to put my stuff out there to anyone aside from the practitioners that I've hired. So I'm going to be launching my notes. I'm going to be launching like a mentorship program. And I'm going to be doing a lot more in the ways of creating a network and a web of help, because I think it felt really scary. I felt like it was too egotistical of me to, expand my knowledge as if that's like what's going to help humanity. But ultimately, I think I do have quite a bit of it, and I think it can help quite a few humans. So help me, help you, help others, and get excited for 2025. Thank you so much for listening this week. Every time that you listen, you share, you rate, you review, it helps boost our show, which not only gives me the motivation to carry forth, but also helps attract new guests with new information. So thank you so much. Please don't forget, again, rate, review, subscribe to our YouTube channel, and we'll talk to you soon on the next episode.